Good morning, class. I have chosen the journal Digital Intervention for People with Co-occurring Depression and Alcohol Symptoms. This journal is mainly intended for individuals with co-occurring depression and also alcohol use. So, coming to the first question, describe CD intervention and whom it was intended for. A concurrent disorder is a type of therapy that simultaneously treats mental illness and substance use disorder. Concurrent disorder's main objective is to assist patients in overcoming their diseases and also enhancing their general quality of life. And as I've said, this journal, it is mainly intended for individuals with co-occurring depression and alcohol use, and also with individuals who struggle with both depression and problematic alcohol use would be the target audience uh, for this concurrent disorder intervention. So coming to the next question, how is this method done and was it successful? In this method, trials investigating digital therapies for alcohol use and depression were looked up in 7 databases. So here, random effects meta-analysis were done on depressive symptoms and also on alcohol consumption up to a period of 3 month and 6 month follow-ups. And here they have used grade to evaluate each results overall quality. And yes, it was successful. All the combined effects was in their favor. In this study, patients with co-occurring depression and problematic alcohol use were evaluated for the impact of digital therapies concerning any control group on depressive symptoms and alcohol consumption. And it was, at various times, follow-up times. So according to the findings, digital treatments had a marginally positive effect on depressive symptoms at the 3 month mark and a non-significant effect on the depressive symptoms at 6 month mark. Also, a minor but also significant effect on alcohol consumption was discovered at the 6 month mark and a non-significant effect on alcohol use at the 3 month mark. So, if we look at the results here, as we can see, the digital treatments, the findings, it had a positive effect on depressive symptoms at a 3 month mark and a non-significant effect of depressive symptoms at the 6 month mark. At the same time, we can see a significant effect of alcohol on the consumption was discovered at the 6 month mark and non-significant effect on alcohol use at the 3 month follow-up. So what did it improve specifically for the service users? So first of all, digital treatment may be it can be a good substitute for those who doesn't want medical attention. So who doesn't want to go into clinics and have a therapy. It is also both professionals and patients are supportive of digital therapies for depression and problematic alcohol use. The majority of patients, you know, thought that using digital interventions such as encouraging text messages or online CBT or MI would help them to limit their alcohol use and improve their mental health. Um, Coming to the next slide, is there enough evidence provided in this article that this would be a good intervention to deploy? Despite the evidence demonstrating the effectiveness of digital interventions for people with depression and problematic alcohol use, there are still limitations to it, such as inconsistent results. Inconsistent results of the sensitivity analysis on the alcohol use at 6 month follow-up. Also, they have conducted a very small number of included studies with sometimes very small samples, which also limits the power of the current study. I'm sorry. So also additional research needs to be done. So according to their test, digital therapies are helpful for those who have depression and problematic alcohol use. And according to the research, digital interventions can reduce depressed symptoms at a 3 month mark and alcohol use at a 6 month mark. So, um, in order to strengthen their evidence or in order to strengthen their test, evidence-based treatment choices for adults with comorbid depression and problematic alcohol use, additional research needs to be done. Additional research is required to support their current findings. So next question, what stages of change should a client be in to engage in it? Would it work well for clients who have experienced trauma? So, digital therapies have generally been found to be successful for variety of clients, including those who have experienced trauma, mental health, and substance use disorders. Uh, the degree and duration of the trauma, as well as person's level of engagement and drive to participate in the interventions, all have an impact of how effective these interventions are. So, in my opinion, digital intervention should not be utilized in place of traditional therapy or any type of professional assistance, especially for people with severe or complex mental health and substance use disorders. Digital interventions can be helpful in addition to other types of therapy, but they should not be, they should be utilized in collaboration with other therapeutic modalities to offer clients holistic care. Coming to the last questions, gaps in the literature, whether anything you thought was missing, do you have any concerns or cautions? Um, First off, despite the evidence of the effectiveness of digital interventions being found in the meta-analysis, the study did not examine the precise mechanisms or elements of the interventions that were most successful. Secondly, the potential drawbacks or unintended consequences of digital interventions were not examined in the study, even though these interventions are generally safe and successful. It is also very crucial to take into account of any potential dangers and difficulties, such as problems with confidentiality and privacy, as well as the requirement for human support or follow-up. Thank you.